Hi, my name is Madison Haiman. My research is on perinatal substance use and maternal and reproductive health policies, and I am a soon-to-graduate doctoral student at UT Social Work.
Hello, my name is Daniel Knight. I research lung and pulmonary health, and I am a first-year doctoral student at UT Social Work.
Hello, my name is Xiaoyi Zeng. I research on supporting the well-being of older people with dementia. I am a third-year doctoral student at UT Social Work.
So my dissertation research is on perinatal substance use policies. All substances other than nicotine are addressed in these policies. So looking at alcohol, looking at illegal drugs, looking at prescription drugs, even taking drugs as prescribed, all fall within the scope.
So I first started getting interested in health disparities because I grew up in East Texas. Seeing that people were not having enough oxygen to get through the day for their appointments, as a small kid, it naturally made me concerned and worried for them, and especially because they had to advocate for themselves to say, hey, I can't wait here all day for my appointment. I have to get home to recharge my tank.
My day-to-day job was to support with conducting memory evaluations. They told me they were feeling lonely, they were isolated. I had a very good opportunity during my first year doctoral program. There was a Good Neighbor Project grant opportunity from the Moritz Center for Societal Impact. I talked with my mentor, Dr. Yuanjing Zhou, and Dr. Noel on this project, and we came up with this good idea about this research project called Creating Dementia-Friendly Neighborhoods to Combat Loneliness and Social Isolation.
Most of the research to date shows little to no effectiveness for any of the policies that are in place for addressing substance use during pregnancy, whether they be punitive, supportive, neutral. So there really needs to be more research in the area to ensure that we know how these policies are actually impacting moms.
One of the things I've learned in my first year as a doctoral student is I learned how to use data collected from big government organizations like the National Alliance of Mental Health, those kinds of organizations, to examine moderators in the asthma mental health context.
And now, using the power of research, I could talk to them and help them by sharing their story and also contributing to science what the community have shared with us, and develop community-driven interventions and programs to give back to the community.
I have learned that what we think is the clear-cut answer isn't always the case when you look at the research. So it really reinforces the need to listen to the evidence, to look at the evidence when you're making policy decisions, when you're making clinical social work decisions across the board.
So my research matters not only because of the over $400 billion cost to society, but also to the cost of those people's lives, like I saw as a child with that lady with the oxygen tank.
When I applied for a PhD program in social work, UT Austin was my first choice. The first day of my campus visit here, I immediately felt a welcoming and supportive atmosphere, and I felt here at UT Social Work, doctoral students were treated as junior faculties, and no matter it's faculty or staff or just students here, they really were eager to learn about you, learn about your research, they want to celebrate all your little milestones in your life, and they want to do everything to support you to succeed.
I first got interested in UT Social Work because of their commitment to looking at substance use challenges kind of across the spectrum. Being at UT Social Work has impacted my research by really educating me on how to think through the research process. Now I think really critically about the questions I ask and make sure every piece of the research is intentional to look at all aspects of the work that I do.
It was actually always my dream to come to UT Austin since I was a kid. My sister moved here first, and as I got into practice, I started noticing all the great research coming out of UT Social Work, and that made me want to come even more. So I'm hoping to use my work on in the mental health asthma connection to further study interventions that social workers can make. These things are preventable, and together we can prevent it.
I think what we have in place needs to be what's going to best support moms, infants, families, and those that support them through social work, medical, the child welfare system across the board.
One thing someone can take away from my research is how some simple things we do in our neighborhood can make a big deal on older people's life that could put a big smile on their face and could make them feel good about themselves and live happy in the community.